When you walk into a patient's room and see a million family members. Family Guy, South Park, Simpsons, and more. Today, we are reacting to hilarious cartoon medical memes brought to us by some of your favorite animated shows. Will they be medically accurate? Probably not. Will they make us laugh? Most definitely. Let's dive right in. Me, it's just a cough. My parents, it's just a cough. The doctor, it's just a cough. Google. Yeah, you're dead. So anytime you look something up on the internet, it's gonna give you the worst case scenario. I guarantee you it's always gonna say cancer. But most of the time, it is just common cough, cold, something simple if that's the case. But obviously, if you're concerned, talk to your doctor, get it done. When a patient doesn't want to cooperate with any of the medication or treatment, okay, get in. Oh my gosh. This is so common. So many patients come into the emergency department. We need a medic here, stat! Blood pressure's through the roof or something like that. And you say, hey, do you have a history of blood pressure? Yes. Do you take your blood pressure medicine? No. We're trying to help you. Please take the medications that we prescribe. You have 10 hours to live. Me? Biggest boy. So maybe Chris always wanted to be in this type of pageants or body. So YOLO. Doctor, you're pregnant. Congratulate me. There are many times that somebody's there for like nausea, vomiting, or abdominal discomfort, and we check pregnancy test and we have to tell them that they're pregnant. Sometimes there's shock, sometimes there's anger, sometimes there's nothing, and other times there's like crying and happiness. But there are options out there. First off, if you don't want a baby, use protection in any which way possible. Barrier protection, medication protection, abstinence. I totally get this. I just hope that nobody's actually doing this. Doctor heals a dying person. That person's family? Thank God he's alive. The doctor that healed him. This happens all the time. The family's so excited, they kind of forget to give credit to the staff and the hospital and the doctor. But we're there to do our job. We love it. And as long as it's a good, positive outcome, it doesn't matter. Time for a diagnosis. I lost another one.
Another one.
Oh my God. For me in the emergency department, I actually don't need a diagnosis. We just need to put down symptoms. If we don't have a diagnosis, we can put shortness of breath. We can put chest pain. When you write 16 respirations, but don't actually count them, Christ is watching. This is basically saying like, maybe you're just making that up and you're not actually counting. It's actually quite funny for me if you ever see an odd number, because that's kind of weird. Anesthesia invented 1846, doctors in 1845. Nice. We can use an anesthetic to numb up an area, or we can use anesthesia to basically knock you out so you become unresponsive, but we're controlling your airway. And we have different degrees. In the emergency department, we'll actually do moderate sedation using different types of anesthetics, but we can still keep you breathing on your own and make you aware of what's going on, but you're not really hearing. So it's a huge spectrum. When they ask you to show the new nurse around, this is where I come to cry. Cool. Oh man. Even myself, I'll get frustrated in a case or something like that, or if somebody dies, I might need my time to go somewhere off on my own, because one, you don't want to show the emotion and you have a job to do, right? Go deal with whatever emotion it is you need to deal with, and then come back and hit the ground running. Doctor, saves your life, credit card declines. Doctor, free trial of living has ended. Oh my gosh. No. I never know if somebody has money or not. I never know if somebody has insurance till like later down the road. We treat everybody the exact same. This is not a free trial situation. Why did you take your antibiotic at 6 a.m. when I told you at 9 a.m.? Me? I wanted to surprise the bacteria. Some medications are Q 6 hours, Q 12 hours, Q meaning every, and sometimes they're TID, BID, QID, meaning like BID is twice a day, TID is 3 times a day, QID is 4 times a day. The reason for that has to do with the half-life of the medication and the metabolism of the medication. So if you're taking it too soon, the medicine hasn't finished what it was doing, so you're taking almost a little bit extra in that moment. Versus if you wait too late, there's a period of time where you don't have the medication in your system. Sometimes people forget, and that's fine. You can always set a timer on your phone. Doctors, don't worry, the X-ray is completely safe. Also doctors, locked behind the door. One X-ray is equivalent to 1 plane ride. So you're getting a little bit of radiation exposure, but not a lot. Versus like a CAT scan's like thousands of X-rays. But think about this. I see 20 patients a shift. Each patient may have an X-ray or not. If I'm standing right there, I'm getting exposure to 20 X-rays versus that patient's only getting exposed to 1. Good news, you don't have herpes. Get well soon. Oh my gosh. It is good news when you find out you don't have herpes, because it's a virus and it can lay dormant in your body forever. Nothing to worry about, just keep soaking it. Oh my gosh. The only thing I tell people to soak when they go home is an abscess or infection that's going to be an abscess. Use a warm compress, maybe warm water to draw it out. Or if you have like bad hemorrhoid or an anal fissure, after you go to the bathroom and have a bowel movement, you sit in a sitz bath and soak butt to clean it out. Most of the time, if a doctor's telling you just keep soaking it, do they really know what they're doing? An apple a day? Doctor. Oh, I get it. Not just an apple, but good diet, balanced, eating the rainbow of veggies and fruits and protein, which then will keep you healthy and keep diseases and medical problems from hurting you. And it could keep you regular. When your shift was over 30 minutes ago and you are at the ER like, bye. So if my shift ends at 5 o'clock and somebody rolls in at 4:45 with a heart attack, I can't let that patient just wait for the next doctor. I have to see that patient and I'm not leaving at 5 o'clock. Doctor, lose your weight to be healthy. Also, the doctor, oh damn. If I heard from an overweight or obese physician telling me to lose weight, it's not gonna really hold that much weight. So that is why I'm in shape, keeping that six pack. Don't just say, hey, you need to lose weight. Help, give suggestions, ideas, books, things that you can do to guide somebody. It's over, Stan. COVID is here. Soon, only 99.98% of us will remain. Oh man, survival rate of COVID, 99%. But think about that when it comes to billions of people. That small percentage is actually a lot of people. Millions of people have died of COVID. Throw this meme out, I don't like it. Doctors be like, go buy this. So I bought a snake. That's so funny. Thank goodness everything's electronic. The only thing I ever have to write with my penmanship is actually my signature. My signature is pretty horrible, but because we have to sign things so often. Oh my gosh. When you walk into a patient's room and see a million family members. Yes, that's actually very accurate. I can only speak for myself. I got good game face, and I learned that a long time ago because I went into a room once when I was a medical student and the patient was like, are you okay? I guess I had it like written all over my face. That it was like shocking. But now, walk into a room, no problem. Pretty confident guy here and know what I'm doing, know what I'm talking about. These were funny. If you guys have any memes that you want me to check out or you think really funny that I might get a kick out of, please send them my way. And as always, check out this playlist right here. Make sure you subscribe, turn those bell notifications on, hit that like button for me, please. Thank you so much for watching and stay healthy, my friends.